Something that's always remarkably surprising from the stroke literature, for example, is that people with the most devastating strokes, once they've gotten over that acute phase and they've lived with that disability, actually rate their quality of life on par with those who would not have disabilities. There's this one surgery that we offer to people who've had the most devastating strokes, where it's life-saving. And people often say, well, should I even bother offering that because they're going to be left with so much disability? And if you actually interview those very people who've experienced that surgery, say, would you still have asked for that life-saving procedure, or would you have been better off dying? And it's an overwhelming 70 to 80% who will say, absolutely, I would want that life-saving surgery. And their family, who may be burdened with their caregiving, for example, echoes that thought that, yes, this is a life still worth living. And it's amazing, but it's almost hard to believe it until you see those people and you ask them that question. And it's so uplifting to see, even though what I perceive as perhaps a very difficult life, a challenging life because of functional dependence, is a life that is worth living, that has meaning, and really brings meaning to those around them as well. The reality is, referral to an assessor for medical assistance in dying gets you to someone who may not be an expert in what it is that you're presenting with in your medical condition. Medical assistance in dying assessors are often very pro medical assistance in dying and see autonomy as the most important value. And so if a patient is requesting it, that assessment happens to be, are they able to consent or not? And unfortunately, we're just seeing such high rates of acceptance for medical assistance in dying when there would be concerns and real concerns about whether this patient is even truly terminally ill. So I already see exceptions to the law being broken, and really a clear lack of safeguards. When we're asking MAID assessors to see these patients, it's easy for them to come up with any sort of reason to say that there's some sort of illness that makes death reasonably foreseeable.